Hi everyone, my name is Jordan Fredrickson and I am here to give my oral presentation on a professional practice model. I chose to do the professional practice model for the Bon Secours healthcare system, which is local to this eastern part of Virginia. The mission of Bon Secours is to bring compassionate healthcare to all that need it and to be good help to all of those in need, including those who are sick or dying. Bon Secours system is a Catholic-based for-profit healthcare system that has 3 hospitals in the Hampton Roads areas. Maryview, which has 346 beds, DePaul, which has 150 beds, and Mary Immaculate, which has 123 beds, in addition to 4 hospitals that are in Richmond. Those hospitals in all of the areas are acute care centers, but they also have other practices in the areas that are assisted living residences, physical therapy centers, oncology centers, pulmonary vascular centers, all kinds of different specialty cares for other needs. The professional practice model that Bon Secours has is based on Jean Watson's theory of caring, in addition to her 10 curative factors that she came up with. Bon Secours uses both of those as a framework for their professional practice model. With their professional practice model, they hope to support their goal in caring for patients in a way that honors the sacredness of humanity and actively participates in bringing loving kindness into all relationships. The 10 tenets of Dr. Watson's Caritas process that Bon Secours brings to their practice are practicing love and kindness, instilling faith and hope, nurturing individual spiritual beliefs, developing helping, trusting relationships, promoting and accepting the expression of negative and positive feelings, using creative problem solving, performing teaching and learning that addresses the individual needs and learning styles, creating a healing environment for the physical and spiritual needs of a patient, assisting with physical, emotional, and spiritual human needs, and allowing rooms for miracles to take place. The 10 Caritas principles are strategies for putting love and heart-centered caring practice into actions, and so Bon Secours has taken those 10 principles and put them into 5 domains of professional practice, which are the basis of their professional practice model. Those practices and structures in their professional practice model are put in place in order to encourage exemplary professional practice, evidence-based practice models, and patient outcomes. Those 5 domains are caring, which is the central tenet of the Bon Secours practice model, transformational leadership, which is a leadership model that strives to inspire others to incorporate new higher levels of thinking in order to promote the mission of Bon Secours as well as the best possible patient outcomes. Relationship-centered care, which endorses a delivery model centered on the relationships between all members of the patient's healthcare team. So that's providers, doctors, nurses, the patient's family, and any community support that they may have. The 4th principle of the professional practice model is professional growth and development, which encourages the growth of all employees in order to improve the effectiveness and quality of care given at any Bon Secours facility. And then the 5th and final one is new knowledge and innovation, which states that Bon Secours is continually striving to deliver evidence-based practice by actively engaging in discussions about their best care practices, participating in continuing education on all employment levels, and financially supporting research opportunities when possible. The 5 domains of their professional practice model come together in order to build and encourage collaborative interdisciplinary practice. And within that collaborative interdisciplinary practice, Bon Secours has identified 4 more principles. And those principles are effective and consistent professional communication, unit norms, professional shared governance, and healthy interdisciplinary relationships. So their mode of thinking is that those 5 principles together, when they are successfully implemented, will then encourage those other 4 interdisciplinary practices. And together, they will come together to create an environment that supports the exemplary professional practice, promotes evidence-based practice, and delivers excellent patient care outcomes, which is, of course, the goal of any successful professional practice model. The goal that Bon Secours has established for their professional practice model is to take a new approach to patient care, which in summary, means that they've deemed all of that patient care together as a clinical transformation. And so their goal is to transform the way that they clinically practice to encourage better patient outcomes. This clinical transformation is also an interdisciplinary approach that embodies the missions and values of Bon Secours, the Caritas principles of Dr. Watson, and the professional practice model that they already outlined to improve the quality of care, to create holistic patient experiences, and to reduce healthcare costs. When I was reading this professional practice model and coming up with a critique of it, my first thought was that it is original and it is clearly written and it's applicable to all parts of the healthcare team, including nurses, doctors, patient, and families. It does get a little convoluted with the 5 principles that lead into the 4 other parts of interdisciplinary practice, which all come together to create this clinical transformation. But I understand that they wanted to address a lot of different points in all of those in those principles, and so the best way for them to do that was to separate it as the way that they did. But like I said, it does apply and reference, all parts of the healthcare team, and I especially appreciated that nurses were addressed multiple times in the professional practice model. They are the focus of the relationship-centered care tenet, which within that it states that the hospital or Bon Secours healthcare system actively believes in and supports the role of the nurses as the bedside care leaders, which I thought was really progressive, and it helps to affirm the role that nurses have within the healthcare system. Nurses are also referenced in the professional growth and development section, and they're encouraged to engage in professional learning and continued education and personal reflection in order to be active participants in planning care interventions with other members of the healthcare team. It addresses patient and family as the central tenets of the first principle, the caring principle of the professional practice model. And the whole principle is written with emphasis on the nurse's connection and the therapeutic relationships between the nurses and the patients. From my clinical experience in Bon Secours facilities, I can attest to the fact that each unit has a copy of this professional practice model posted in their unit break rooms. And then it has any unit-specific additions to that. So, for example, on the ICU, they have unit expectations and norms for care plans, charting, admissions, things like that. And I think this is a really good idea because it shows support for the professional practice model and encourages compliance to all of the principles that the model outlines. I believe that the Bon Secours model, professional practice model, is a good example of a comprehensive schematic that clearly communicates the beliefs, the values of Bon Secours, and the theories that they've chosen to help guide the care given in their facilities. The professional practice model clearly addresses the values, professional relationships, and patient care delivery model, but I think it lacks direct reference to the management approaches and compensation and rewards for employees that are a shining example of this professional practice model that they have published. I would suggest that Bon Secours edit the professional practice model just a little bit to include how they would recognize the professional achievement goals that they reference to in the professional growth and development section, and the ways that employees are rewarded for contributing to the organization's professional goals that are detailed and outlined in the model. Thank you for watching. I hope this was a good experience for you to learn a little bit more about a professional practice model of a local healthcare system.